Have you ever wondered how prevalent cancer is in our society and how it impacts people's lives? It's a question that many of us may ponder, and the answer is both startling and sobering. Across the globe, cancer affects millions of lives, becoming a word we are all too familiar with. From the bustling cities to the tranquil countryside, cancer does not discriminate. It impacts people of all ages, from all walks of life. It's a battle that many face, a silent enemy that works in the shadows, but it's not an enemy that's invincible. The importance of understanding cancer cannot be overstated. It's not just one disease, but many different types, each with their own causes and characteristics. Knowledge is our best defense. It's our lantern in the dark, our compass in the storm. Understanding the types of cancer, their causes, treatments, and survival rates can empower us all. With knowledge, we can face this enemy head-on, and one day, hopefully, conquer it. First up, we have lung cancer. This form of cancer predominantly originates in the lungs, but it's not exclusive to those who smoke. Exposure to radon gas, secondhand smoke, and harmful substances like asbestos can also lead to lung cancer. As for treatments, they can vary greatly depending on the type and stage of the cancer. Options may include surgery to remove the cancerous part of the lung, radiation therapy, chemotherapy, or a combination thereof. In more recent years, targeted therapy and immunotherapy have become increasingly utilized, aiming to specifically attack cancer cells. The survival rates for lung cancer are improving, but much depends on early detection. The 5-year survival rate for localized lung cancer, that is, cancer that hasn't spread outside the lungs, is around 56%. For cases where the cancer has spread to distant parts of the body, the rate drops to around 5%. Early detection and treatment is key in the fight against lung cancer. Next, we delve into breast cancer. This common cancer can occur when cells in the breast start to grow out of control, typically forming a tumor. Several factors may increase the risk of breast cancer, such as age, genetics, a personal history of breast conditions, and lifestyle factors like alcohol consumption and lack of physical activity. Treatment options vary depending on the stage of the disease and can include surgery to remove the tumor, chemotherapy, radiation therapy, hormone therapy, and targeted therapy. Each treatment has its unique benefits and potential side effects, and often a combination of treatments is used. Survival rates for breast cancer have improved significantly over the years, thanks to advances in detection and treatment. The 5-year relative survival rate for women with localized breast cancer is around 90%. However, it's essential to remember that every individual's experience is unique. Awareness and regular checkups can make a huge difference. Let's explore prostate cancer. This is a common cancer that develops in the prostate, a small gland that produces seminal fluid. Although the exact cause of prostate cancer is unclear, risk factors include age, family history, and race. Men over 50, those with a family history of prostate cancer, and African American men have a higher likelihood of developing this disease. Treatment options can vary depending on the stage of the cancer and the patient's overall health. They range from watchful waiting or active surveillance for slow-growing cancers, to surgery, radiation therapy, hormone therapy, chemotherapy, or immunotherapy for more aggressive types. Survival rates for prostate cancer are generally high. The 5-year survival rate is nearly 100% for local and regional stages, and it drops to about 30% for distant stage cancers. Remember, early detection is key. Prostate cancer is treatable if detected early. Moving on to colorectal cancer. This type of cancer is often caused by certain lifestyle factors such as a diet low in fiber and high in fat, lack of physical activity, obesity, alcohol consumption, and tobacco use. Some people may also have a genetic predisposition to developing colorectal cancer. Treatment options for colorectal cancer can vary depending on the stage of the disease. Early stages can often be treated with surgery alone, whereas more advanced stages may require a combination of surgery, chemotherapy, and radiation therapy. Survival rates for colorectal cancer have been improving over the years due to advancements in treatment and increased awareness, leading to early detection. For localized cases, the 5-year survival rate is around 90%. This figure decreases significantly for regional and distant stage cancers, emphasizing the importance of early detection. Remember, your health is in your hands. Regular screenings and a healthy lifestyle can significantly reduce your risk. Early detection can save lives. Now, we'll look at skin cancer. This common cancer is often linked to ultraviolet radiation from sunlight or tanning beds. Two main types exist: melanoma, which is more dangerous, and non-melanoma, which is less severe but more prevalent. The causes aren't solely sun-related though. Other factors like genetics, a weakened immune system, or exposure to certain chemicals can also play a part. When it comes to treatment, options can range from simple procedures like surgical removal of the cancerous skin to more complex treatments like radiation therapy, chemotherapy, or immunotherapy. The chosen route typically depends on the type and stage of the skin cancer. Survival rates are generally high, especially for non-melanoma skin cancer. For melanoma, early detection is crucial. If caught early, the 5-year survival rate is over 90%. Remember, regular skin checks and sun protection are your best defense. Prevention is better than cure, especially with skin cancer. Next on the list is stomach cancer, a malignant condition that primarily affects the stomach lining. It's often linked to long-term inflammation and infection, particularly from a bacteria known as Helicobacter pylori. Other risk factors include a diet high in smoked and pickled foods, tobacco smoking, and certain genetic conditions. Treatment options vary based on the cancer's stage and the patient's overall health. Surgery, chemotherapy, radiation therapy, and targeted drug therapy are common approaches. In some cases, a combination of these methods proves most effective. Survival rates for stomach cancer largely depend on how early it's detected and treated. For localized stomach cancer that hasn't spread outside the stomach, the 5-year survival rate is roughly 65%. However, if the cancer has spread to surrounding tissues or organs, the rate drops significantly. Regular checkups can help detect stomach cancer at an early stage. So, don't hesitate to consult your healthcare provider if you experience persistent, unexplained stomach discomfort. Let's discuss bladder cancer. This type of cancer arises when cells in the bladder begin to grow uncontrollably. The most common cause is smoking, accounting for about half of all cases. Other factors include exposure to certain chemicals and chronic bladder inflammation. In terms of treatment, there are several options. Surgery, often combined with chemotherapy or radiation therapy, is the most common treatment. Immunotherapy, which boosts the body's natural defenses to fight cancer, is also an option. Survival rates for bladder cancer depend on various factors, including the stage at which it's detected. The 5-year survival rate for localized bladder cancer, that is cancer confined to the bladder, is approximately 70%. However, for bladder cancer that has spread to nearby organs or lymph nodes, the rate drops to about 34%. Early detection is key. Regular checkups and being aware of the symptoms can make all the difference. Bladder cancer is treatable when detected early. Next, we'll cover non-Hodgkin lymphoma. This type of cancer originates in the lymphatic system, the disease-fighting network spread throughout your body. The causes are not completely understood, but it seems to occur when your body produces an excess of abnormal lymphocytes, a type of white blood cell. Risk factors include age, with most cases happening in people 60 years and older, certain chemicals and medications, and a weakened immune system. Notably, it's also linked to certain infections, such as the Epstein-Barr virus. Treatment options vary depending on the stage and type of non-Hodgkin lymphoma. They can range from watchful waiting for slow-growing types, to chemotherapy, radiation, targeted therapy drugs, or stem cell transplant for more aggressive forms. Survival rates have improved over the years, with a 5-year survival rate of about 72%. Remember, these figures are averages, and individual prognosis can vary. Regular checkups can detect non-Hodgkin lymphoma at an early stage. Finally, we'll discuss kidney cancer. This form of cancer originates in the kidneys, two bean-shaped organs that filter waste from your blood. The causes of kidney cancer are not completely understood, but certain factors increase the risk, such as smoking, obesity, and a family history of the disease. Treatment options for kidney cancer vary based on the stage of the disease. Early stages may be treated with surgery to remove the tumor or even the entire kidney. More advanced stages might require targeted therapy, immunotherapy, or radiation therapy. Now let's talk survival rates. 5-year survival rates can provide a glimpse into the prognosis of this disease. For localized kidney cancer, where the disease is confined to the kidney, the 5-year survival rate is about 93%. However, for cases where cancer has spread to distant parts of the body, that rate drops to about 12%. Early detection of kidney cancer can significantly increase survival rates. In conclusion, Understanding these common cancers, their causes, treatments, and survival rates can empower us all. We've journeyed through the complexities of lung, breast, prostate, colorectal, skin, stomach, bladder, non-Hodgkin lymphoma, and kidney cancers. We've unpicked the threads of their causes, from genetic predispositions to environmental factors and lifestyle choices. We've explored the wide array of treatments, ranging from surgery and radiation therapy to chemotherapy and immunotherapy, and the hope they bring. And we've examined the survival rates, acknowledging the strides made in medical science while recognizing the battles that still lie ahead. Knowledge is indeed power. By comprehending these common cancers, we arm ourselves with the tools to stay vigilant about our health, to promote early detection, and to champion the cause for continued research and advancements in treatment. Stay informed, stay healthy, and remember, early detection can save lives. Don't forget to like this video and subscribe.